Okay, the August 21st meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Ansello. Here. Ms. Andrews. Here. Mr. Daniele. Here. Chairwoman Draw.
Here.
Ms. Cayley. Here. Mr. Lightfoot. Mr. Michike. Here. Dr. Quattro. Here. Mrs. Valerio. Here.
Thank you. Before I go on, I would like to welcome Legislator Mary Valerio to the Human Services Committee. You will be a valuable addition, I'm sure, to our committee. I know you do. So thank you for joining our committee. Is there anyone signed up for public forum?
There is not.
Okay. And there's no one here. So the next item on the agenda is the approval of minutes. You have before you the May 22nd minutes. They will stand approved unless the clerk is notified by any changes by the end of the day. And next, I have the honor of having both Commissioner Kelly Reed here and Bob Franklin, also our Deputy Commissioner from Human Services. And at this time, I'd like to let them have the floor and give a little brief update. I know it's been a couple months and we had some questions. I believe that Legislator Andrews have some questions submitted and we wanted to follow up on those. And so I will turn it over to both of you.
Thank you very much. I'm happy to answer some questions that were provided to us, and then if you have some additional questions after I offer the summary, please feel free to ask us some additional questions as well. I know you were curious about the number of children receiving subsidized care, and right now, as of the end of July, we have 7,150 children receiving subsidized care. There was a question regarding the decision to process upfront denials for child care subsidy as opposed to actually lowering the eligibility rate. What that actually translates into is we freeze the approvals for new daycare whenever the allocation begins to demonstrate itself as low, instead of moving from 165 down lower. It's important, September 2008 is the last time we lowered the eligibility rate from 165 down to 125% of poverty. That actually resulted in 561 case closings that affected 963 children. And I know there has been some concern raised in the community at times when we have frozen enrollments, but frankly, there were folks in this chamber who opposed the lowering of eligibility. No matter what we do, it is hard to face situations, excuse me, I'm sorry. It's hard to make a determination of how to say no to a family that needs subsidized daycare. But lowering the eligibility rate did not seem to be a palatable solution in 2008 to a lot of people in this community, including members of the legislature, including advocates from the community, and including providers and families. What it did result in as a necessary part of that change is that we did cause young children to be removed from their child care setting. It did not, as it was sometimes reported and suggested, it did not cause a big uptick in the number of people on public assistance. 12 families of the families we just discussed with you went back on public assistance, but the vast majority figured something else out for their families. When it became apparent that we were going to receive a reduction in child care dollars from the state of New York, and while the county executive maintained her commitment to child care, we still received a cut at the state level and needed to make an alternative arrangement. And because of that state cut, we sat down with advocates and members of the community and child care providers and asked them if there was a preference, if we should lower the eligibility rate, or if we should process upfront denials. They made the decision that processing upfront denials would be less disruptive to families. We have experienced that to be the case. Families have been able to stay in care even though we've had to freeze enrollments. So over time, we understand that from a commitment standpoint, this has been the least disruptive option, and even our strongest critics, people like Jackie Cady from the Child Care Council, actually congratulate us on having made the decision that we did to freeze the applications up front, just simply because it is far less disruptive and much more predictable in terms of funding going forward. We know, as we look at the funding right now, that there is a possibility that that money will continue to decrease, and we know for relative certainty that the child care dollars, which have been supplementing child care, subsidized child care in our community and only in a couple other communities around the state, we've been lucky enough to receive that appears to have dried up. It was not appropriated in this year's budget, and we expect that the child care dollars that was available through the Children's Institute and funneled through us is going to dry up sometime in early September. So it's important that we continue to look at and process in a way that's most realistic and support for families. So from my perspective, I think when we're looking at it, we're looking at freezing the application process rather than lowering eligibility is in our best interest because it is supported by advocates and providers. It promotes subsidy stability and continuity of care for the families that are receiving the subsidy so that they are not removed from care suddenly and without notification. And the county can respond more quickly to funding changes that occur. One of the things we discussed a lot in this chamber is the fact that the child care subsidy for us varies pretty significantly from, or had been varying pretty significantly from year to year. And very often the budget is passed in April and the allocation notification doesn't come for several months, sometimes literally for 5 and 6 months. We still have to provide daycare during that period of time, and if it has been radically cut, we are operating at a profound deficit. This allows us to be much more responsible with both the subsidies we're providing as well as for the taxpayer's dollar, because if we are providing subsidies and that cost is, or that allocation is much lower, we find ourselves in significant deficit by the time we hear from the state of New York what the decision is going to be. And you know that a few years back, we had been fiscally conservative and had a rollover fund that allowed us to take money while we were waiting for those dollars. And while it was $5 million, that's actually not a lot of money for us because we spend $5 million in a couple of months because our subsidy, the dependency on this subsidy program is so significant. So it's important for us, I think, to stick right where we are right now with the dollars. You also asked about waiting lists, and on several occasions there have been questions about waiting lists for eligible families when sufficient funding isn't in existence for us. State legislation was introduced in April 2011 to amend social service law that would have mandated waiting lists. That did not make it into law. For us, it's not a practical process because even if we maintain a waiting list, we must make that family go through the application process when we open the applications again. We have to make them go through the process again anyway. So for us and for the family, it's a significant inconvenience. In addition to that, one of the questions that you asked, I believe, was about child care eligibility being adjusted from 165 to a spread of 165 to 275. Any adjustment like that would need to be negotiated between the Office of Children and Family Services and the Children's Institute. And at this point, we don't believe that the child care dollar funding, which was what allowed this community to take the eligibility to 275, will continue. It was not reappropriated. And I think that's it in terms of continuous updates. We do expect that low-income enrollment, right now I mentioned to you that we have a fairly large number of children in care. In the low-income piece, which is the piece that's primarily affected by the daycare allocation, we're going to need to keep that number as we anticipate where it's going to somewhere between 3,300 and 3,400 to be able to manage what our allocation is going to be and what the county contributes toward it.
Thank you.
You're welcome.
This time, any other questions? Legislator Andrews?
Thank you, Madam Chair. Thank you, Commissioner Reed and Mr. Franklin, for being here this evening. I do have a couple of questions, just in part because this program's rather complex, and I know there are several parts of it. You talked about, I guess, frozen, I can't recall the term you used, but frozen applications or eligibility. Can you, out of the different daycare programs that we have, can you just tell us which ones are frozen, which ones aren't?
It's primarily focused on the low-income daycare, and right now, today, we are accepting applications in all programs.
Okay. And then you mentioned the child care dollars that weren't reappropriated in this year's state budget, and you expect that those funds to be used up by September of this year.
Mm-hmm.
So what happens with folks that are in that program at this point in time? Do they continue on for the year that they've been approved?
Close down applications. We'll actually close down applications, new applications to child care dollars, but the families themselves, because we're not unseating anyone, will actually run the course of their full year of eligibility.
Okay. And at this point in time, through the chair, what is the figure that the county's kicked in to support the child care for the 2012 year?
Madam Chairwoman, we probably would have to take a guess at that tonight. I mean, if we can get back to you.
Would you rather wait and get back to us?
Sure. We can get you the number. I don't recall it off the top of my head. What you're asking for is the amount that's in the 2012 budget?
Correct.
Absolutely. We can get that for you, but we both would be.
Sure, that's fine.
Yes.
Could I also just request through the chair the updated copy of the chart that you provide with the 5 different child care programs and the monthly averages?
Absolutely.
Thank you. And then just lastly, the memo that came from Mr. Franklin to Mr. Helfer to us from May 22nd, where we talked about, where you discussed the declining numbers of children enrolled in child care and the family assistance and low-income programs. Mm-hmm. I wondered if you could just talk a little bit about that phenomenon and why that's occurring this year.
You're right. In that particular memo, one of the things Mr. Franklin referred to it as a hot topic for us. It is a hot topic for us. We always monitor what's happening with each of the categories of daycare we provide. To be honest with you, we're really not sure what's happening with that. We are asking questions about it. There have been questions asked of the large, of the Child Care Council and of the other districts that are facing this. They're seeing a comparable decline, but they're associating that with CCTA, which is the new form of reporting that the state has asked of us for child care providers. I'm not sure why it's happening. We don't really have any good answers for that right now. Child Care Council was not able to answer why they think it's happening, particularly why they think it's happening with regard to the center-based care. We really don't know.
Okay. Thank you.
Thank you again, Commissioner Reed and Deputy Commissioner Franklin for attending tonight and giving us a wonderful presentation there about answering some questions for us.
You're welcome. Thank you very much, Madam Chair.
So now next item on the agenda is new business. Madam Clerk.
Referral 12-238, authorized.
Moved by Legislator Michike, second by Legislator Lightfoot. And since I see the maker of the referral here, Mr. Legislator Michike, would you like to speak about your referral?
Thank you, Chairman Draw. I'm so glad to be joining Legislator Willie Joe Lightfoot in co-sponsoring this referral, which will ease the burden on area small businesses. As one of the new members of the legislature, I am pleased to be working with the other side of the aisle on this issue. I know a large portion of the residents in my district enjoy visiting local farmers markets, whether it's the South Wedge Farmers Market, the West Side Farmers Market, the Grease Ridge Mall Farmers Market, and the Rochester Public Market, or one of the other 20 local farmer markets we have in Monroe County. This referral will encourage more prepared food vendors to take part in local farmers markets and make the experience enjoyable by easing the burden on local businesses in Monroe County. I just want to outline exactly what this referral is going to do for prepared food vendors in Monroe County. Prepared food vendors will now be able to apply for a permit with the Health Department for an annual fee of $170 instead of the $700 to $1,400 range they have paid in the past. The new fee structure will be sure to enhance local farmers markets for members of our community. The vendors will not need to renew their permit every 2 weeks as they have in the past. Also, it is important to note that the Health Department will continue to inspect these vendors at the rate they currently do to ensure the health of the community is not compromised. The submitted proposal will make the new fee category effective January 1st, 2013. I want to thank my Republican colleagues and my colleagues on the other side of the aisle for working together in the spirit of bipartisanship to get this proposal put together.
Thank you, Legislator. Legislator Lightfoot, would you like to chime in there on your referral?
Thank you, Madam Chairman. Yes, good evening, everyone. I just simply want to say I want to piggyback on the last part of Legislator Mitchell Kay's statement about bipartisan work that we've done with this referral. I would state for the record that we have worked hard and tirelessly on this side of the aisle to present this referral before this body 2 years ago, and we're so glad, despite how we presented this today, we're just glad to be where we are today. This makes sense. I continue to say I think it's not excellent government, but it's good government. It's coming together, getting our partisan politics aside, and actually doing something that makes sense for people that prepare foods for our farmer markets. I'm grateful and thankful for the President Jeff Adair for the constant negotiations and conversations that we've had, along with the advocates that have worked tirelessly on behalf of this particular referral. I'm grateful to Majority Leader Daniele for his work on this, as well as all of the staff members I said before who worked tirelessly for us to get this together. And to you, Madam Chairman, I wanted to say that I hope that this is an example, or can be an example, as we move forward in this body to do more work like this for the business of the people. And I'm glad and grateful to be able to co-sponsor this referral, and I'm glad that we were able to finally get something done. Thank you.
Thank you, Legislator Lightfoot. Is there any other questions on this referral? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Congratulations to working together, both sides, to everyone. Thank you. Next item.
Referral 12-240.
Moved by Legislator Quattro, second by Legislator Daniele. At this time, I would like to, first of all, just welcome Ms. Laura Stradley to the chambers tonight. I know that before the meeting, she met with both the Republican committee and then also the Democratic side of the committee, so I know that we've all met you and everything, and we thank you for that. And if there's any questions at this time, would you like to just sit here and stay here and maybe answer them? Legislator Andrews.
Thank you, Madam Chair. Welcome and congratulations. Thank you for coming this evening, Mr. Abbey. Just through the chair, just real quickly, if you could maybe just talk a little bit about your vision for the agency, or what you hope to accomplish in the short term in your new position.
Sure. Through the chair. My vision for the agency is to really create an organization that is a leader in delivering veteran services in this region. We're very fortunate in Rochester, I think, to have a wealth of veteran service providers through nonprofit organizations, good collaboration with the VA and other governmental agencies. And I think that possibly one of the areas of opportunity that our agency with the county really has is to kind of to really serve, as I said, as a leader in collaborating with these other entities throughout the region. In addition, we would like to see the percentage of veterans in this region that we serve increase significantly. In the few weeks that I've been at the Veterans Service Agency, I've been looking at some of the statistics and the history of what the agency has done a little bit, and quite frankly, the amount of veterans that we serve is not where we want to be. Last year, we served 3% of the veteran population in Rochester. So my goal is to increase that number significantly, and I think we're going to be able to do that. I know that we've got a lot of support already with the hiring of an outreach coordinator, actually at the same time as I was hired. We've already gotten very active in the events and the collaboration with other organizations in the community. So I think we're already seeing that number climb slightly. So.
Thank you.
Great. Thank you very much. Good luck. We certainly wish you well, and sounds like you have your work cut out for you. So.
Thank you.
Welcome aboard. Thank you.
Thank you.
So all those in favor signify by saying, oh, I'm sorry, Legislator Cayley, did you have a question?
Thank you, Madam Chair. Welcome. And I just, as a parent of an ex-soldier, wartime soldier, and a mother-in-law of one currently in the service, I just wanted to say welcome, and I'm sure that you're going to be doing your best for them. I did notice a couple things that just kind of struck me, and way back when, your efforts to work for a better single soldier programming. I found that that's extremely important, and I, as soldiers go through a great deal of change, and so many of them are in the single soldier program, and it needs to be, I'm sure that it was a strong thing for you to be doing. And the other thing that just caught my eye was Laura has been one of the best instructors I've ever encountered, though her rules may be a little stringent. Somehow I think that came from there. And the mother of a daughter who changed drastically after 8 years service in terms of being rule-oriented and structured. It spoke to me very loudly, so I just wanted to welcome you.
Thank you very much.
Thank you.
So all those in favor signify by saying aye. Any opposed? Welcome aboard. Congratulations. Thank you, Ms. Straven. Next item.
Referral 12-241, confirmation of
Moved by Legislator
appointments.
Valerio and seconded by Legislator Michike. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Just real quickly, were these vacancies on this board, or were there 4 appointments that expired, or are any of these reappointments?
Didn't want to continue serving, so these are new people. Madam Chair, all 4 of these are new members of the board. They will be replacing current members who have declined to continue serving.
Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? And next item.
Referral 12-251,
Moved by
authorize.
Legislator Ansello and seconded by Legislator Daniela. Any discussion? Legislator Cayley?
I'm sorry, thank you. Through the chair, as reading through the referral, is this the first time that this contract with HealthTrack has been issued?
Through you, Madam Chair. No, it's not. HealthTrack has served MCH for about 15 years.
Oh, thank you. That's all.
Any other discussion? All those in favor signify by saying aye. No. Any opposed? Item carries. Next item.
Referral 12-252, acceptance.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you, the referral accepts about $319,000 and then authorizes a contract for $20,000. So I was just wondering where the rest of about the $300,000 remaining, where does that go?
Through the chair, about $108,000 of those for salaries of existing positions, including a public health emergency preparedness manager, public health emergency preparedness specialist, and office clerk. There's an additional $41,000 plus in fringe benefits, another $41,000 in supplies, an additional $3,000 in travel, mileage, and education, another $3,400 in equipment, miscellaneous for $56,000. Contractual piece, is about $36,000, and the administrative expenses are about $29,000.
Thank you very much. Then one last question. The last sentence of the third paragraph just refers to vaccination services or other types of medical countermeasure dispensing during an exercise. It just piqued my curiosity. What would that be? Through the chair.
Through the chair, so for example, there may be particular types of drills or exercises that come up. And for a particular type of drill, as one example, that could include, doing vaccinations to a specified number of folks with a specified number of throughput. And so in that circumstance, through the contract, we would actually have other nurses through that contract who would administer the vaccination during that time period.
Okay. Thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-253.
Moved by Legislator Valerio, second by Legislator Michike. Is there any discussion on this? Legislator Cayley.
Thank you, Madam Chair. Through the chair, could this funding represents a decrease of $13,287. Could you speak to whether or not that will be a decrease in the number of recipients of the benefits or a decrease in benefits received?
Excuse me, through the chair, that decrease, will represent, a decrease in the dollar amount for peer counselor contracts, as well as an estimated decrease in the COLA for the fiscal year of 2013.
Thank you.
Thank you. Any other discussion? All those in favor signify by saying aye. Any opposed? Next item.
Referral 12-254.
Moved by Legislator Michike, second by Legislator Ansala. Is there any discussion on this? Legislator Anders.
Thank you. I had a question. What sort of case would be considered a potential HIV or AIDS case? I just want to understand a little bit better what medical records get reviewed here and what sort of data gets provided to the state through the chair.
Through the chair, the types of cases that are include middle chart review and reporting of up to about 500 records that have been assigned to Monroe County by the New York State Department of Public Health. These are used for the purpose of doing epidemiological studies, but also to identify high-risk groups and high-risk zip codes within Monroe County. They also provide assistance in funding funds to the appropriate educational programs and preventive programs throughout the county.
Thank you. That's helpful, but I guess I still don't really understand what exactly do we provide from the state as a result of undertaking this HIV surveillance program?
Through the chair, we gather, additional information, from folks, who are coming with an HIV diagnosis, and through that record review, we actually are able to assess additional information from them. So that may include, information not limited to other risk factors that may be social in nature, but also may provide information with regards to contact in terms of folks that they may have been with. And so that information can be funneled to our partner services and help us to identify additional cases.
Okay, great. Thank you very much. That's helpful.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-255.
Moved by Legislator Ansello, second by Legislator Quattro. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you, how much revenue are we anticipating this will generate?
Through the chair, in prior years, beginning with 2009, that was about $2,000. That covered about 6 cases. In 2010, that was about $2,630. That covered about 8 cases. Then in 2011, that covered about 7 cases for about $2,085.
Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-256.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-257.
Moved by Legislator Daniele and second by Legislator Valerio. Is there any discussion on this? Legislator Andrews.
Thank you. To the administration through you, what would be the current staff to client ratio?
Through you, Madam Chair, the average caseload size right now is 17. Our goal would be to get those down to 15, and ideal would be 12.
Thank you. And over the past 4 years, have we made progress towards reaching that goal?
We had been making progress toward reaching that goal at the time that we initiated Project SAVE. Our goal was to get it down further. We've had a significant increase in the number of child protective reports filed, which require an investigation. And in addition to that, we have a fairly significant number of actual staff vacancies and what we refer to as virtual staff vacancies, which are FMLA, other forms of medical leave as well, which drives that number up. This money that's here allows us to focus on those higher caseloads. So we're focusing on staff with 20 or more cases on their caseload.
Thank you. Are you also, through the chair, hiring to try to fill some of those vacancies you just mentioned?
Yes, we are, and we actually have some staff in training right now, and we will be adding some additional folks. One of the things that's a challenge with hiring the staff is there's a very long period of training required, and some of that is within our control, and some of it is scheduled by the state of New York for the piece of the training that's done by the state of New York. So we have to wait for the civil service test to be scored, to canvass the test, to get people through the interview process, to get them through the interview process and hired at a time when the state is offering training, get them through the rather lengthy training process, and then we have also our own training obligations to make sure people are well prepared to do this very difficult job.
Thank you. I don't know if now would be the time. It's not directly on topic or perhaps at the end of the meeting, but we feel our office and perhaps the Republican office as well has received a fairly large increase in number of calls from clients of DHS recently in terms of having difficulties reaching caseworkers and phone calls not being reserved or not being returned. And so I know that staffing seems to be a constant issue. And I wondered if there had been anything that's changed recently or anything that's different that would explain the uptick in the number of calls that we are receiving. If you want me to hold that till the end, if you'd allow it at the end of the meeting, I'd be happy to do so. It is related to a staffing.
It's really not relating to this referral then, really, indirectly, yeah. Would you maybe want to talk to Commissioner Reed offline on that?
Actually, I'd just like to bring it to her attention because we haven't had this meeting in so many months. And over the summer especially, we feel we've been flooded with phone calls. So it is related to staffing, which is why I use
well, let's just
this as a springboard.
Let's just vote on this referral, and then I'll let Commissioner Reed can answer that question.
At the end.
Does that sound good?
Sure.
Okay, great. Okay. Can we vote on, is there any other discussion on this specific referral? Seeing none, all those in favor signify by saying aye. Any opposed, item carries. So now that's, is there any unfinished business to come before this committee? Legislator Andrews.
Through you to the Commissioner, then I would just repeat my question regarding the number of phone calls we've received regarding DHS service at this point in time.
Through you, Madam Chair, it's actually good to separate out the vote on this particular referral and the answer to this question, because this particular referral is related to child protective work, and the phone calls you're receiving are not. They're related to our work on the financial assistance side of the house. And there is, yes, a major change in the way that we are doing business. We've actually implemented a task-based system of doing work, so clients no longer have a caseworker. Essentially, everyone owns every case. And folks are assigned particular tasks related to those cases. So we have two things that are happening with that. One piece is just the natural transition of having people get used to a different way of doing business. And what's happening is they're seeking to call a caseworker, and you're not going to have someone pick up a line and say, I'm the caseworker assigned to your case. the information around how to get through to the customer service line is inside the letters they're receiving, but it's a little ways down, and if they don't read it or listen to the message completely that they're hearing on the telephone, they don't know how to get through then to the customer service line to get the answers to the questions. That's starting to ease up some for us. They're also in the very beginning of this, because it was quite confusing for clients, was a pretty extraordinary wait on the telephone line, on the hold line, but we monitor that on a regular basis, and in the most recent monitoring that we have done, no one has waited any more than 5 minutes, and very often when we have called into the system ourselves, we've been automatically reached one of the customer service folks on the line. So it's a process of getting folks used to the new way of doing business. We do know that we need some additional customer service lines. We have added a few, and we will be adding more in the 2013 year.
Legislator Anders, maybe if there's specific questions in your office, issues that maybe I'm sure that Commissioner Reed, after this meeting, would respond to some of the, or respond to concerns that there are in your office, specifically offline, to the.
I don't want to raise any specific client concerns, particularly to individual people, but just speaking more generally to understand the new system.
Mm-hmm.
So I do have a couple other questions, if you would allow them. Thank you. When you say there's about a 5-minute wait time to get to a customer service representative, is that person then able to actually address the question? Or
Yes.
is that then when they have to wait then to speak to an appropriate person who can assist them?
On occasion, they have to search more into the system, but for the most part, we actually, before we implemented the task-based system, we had an internally designed system called Annex, which allows us to provide information on the entire case in the moment for each one of the clients. So for the most part, the customer service person answering the phone should be able to answer all of their questions.
Thank you. And then after the task-based system's been in place for a while, will you be conducting some sort of review to determine if it's a more effective way of handling the cases and calls?
Through you, Madam Chair, yes, we actually are doing that. Task-based is a system that was implemented by several other districts first. So we monitored their success, learned from what they had happen in their own systems, and actually Annex, for instance, was designed before we implemented our system because of the pitfalls that other districts had recognized, so we were able to learn from them. We regularly are evaluating it and tweaking it on a regular basis. The Nancy Forge, who is our Director of our Director of Financial Assistance, meets with her staff on a monthly basis, and they do pros and cons of the task-based system. I don't anticipate. I'm concerned that maybe your question is suggesting would we revert back to a system where it's a client-based system. The client-based system is not an efficient system, and it did not serve our clients as well. In this chamber, you often heard about the perennial issue of our telephone system not accommodating our clients. This is a profoundly better and in-the-moment system for our consumers. What I can promise you is that we will continue to tweak it until we achieve a level of excellence that we can maintain. We're still climbing that mountain, but we'll get there, and we will achieve that excellence.
Thank you. And then just lastly, then, what advice would you suggest that we give to folks who call us and say that they're having a very hard time reaching someone or getting answers to their questions, or that they're having similar issues of having to reapply and supply the same paperwork over and over again? What would you tell us to tell them?
You can encourage them to give my office directly a telephone call. All of the assistants in the executive suite have been managing calls to help people understand where to look for the information that they need and how to utilize the system. We also advise them. Very often the people that are calling are their advocates who have access to computers, and many of our clients do as well. They can also use the web-based system, because we have a customer service, web-based customer service system as well, where we can answer their questions, and we always answer them within 24 hours. That is actually occurring, where they're answered within 24 hours. So please direct them to my number, and we'll direct them where they need to go. As far as submitting the same paperwork over and over again, we are also now almost 100% a web-based service, so we are scanning documents right when they are received. We picked a point in time and began scanning documents from that point forward, so that really should be a relatively old complaint. You should not be hearing that a lot now, because we are scanning, and it is forever in the system from that point forward.
Great. Thank you very much. I appreciate the information.
You're welcome.
Thank you very much.
You're welcome.
Any other business? Legislator Kaley?
Thank you, Madam Chairman. I just, this is to address to the entire body. In past, we've heard a lot. We've done a lot of approvals of grants for the Nurse Family Partnership, and I had raised the question if we would be allowed to ride along. And over the past month, I've had the opportunity to ride along with a nurse to visit a family with the Nurse Family Partnership. And I just wanted to give you my observations, bless you, whoever that was, that I had the opportunity to meet a very conscientious and sensitive nurse visiting this particular family of two. And I also met with a very gracious and brave young mom of a young child of 8 months, and allowing me to come in, not even knowing, assuming that I was a nurse, and allowing me to come in and be a part of the interview. And I found that the information that was given back and forth was done in a very sensitive and conscientious way from the nurse that was there, soliciting answers and giving the young mom an opportunity to come up with the decisions on her own, which is extremely important to have a sense of confidence. And it definitely sent home, and I also had the opportunity to debrief a little bit with the nurse after we left. But this gave me a new insight to the program. I would encourage anyone on this body to do the same if they have not. It was a very enlightening experience, and it's evident, even from this very gracious mom who was very articulate, that the Nurse Family Partnership is a needful program, and it is serving well, and thank you for the opportunity to be able to do it. That's it.
Any other unfinished business? Legislator Andrews.
Thank you, Chairwoman Draw. Yes, at one of our previous meetings in the late spring, we had talked a little bit about therapeutic foster care. I had asked a couple of follow-up questions because I believe we began insourcing our therapeutic foster care program maybe June 1st or July 1st. I believe at that time we told there would be 24 children who were transferred to the county, and I just wanted to ask, one, I don't think I've been provided yet, what was the cost per day for the county for that program? Two, and then how is that transition going?
Through you, Madam Chair, I can get you the cost per day, and I apologize, I did not recall that question, but we'll get that for you now. You're asking for the cost per day for us to manage a foster care case?
For the specific, yes, the specific program that was insourced again, the therapeutic foster
Okay.
care.
I will get you some numbers, but I would clarify for you, part of the reason why we decided to insource therapeutic foster care is because as our numbers dropped, you'll recall that as a part of Project SAVE, our foster care caseload has dropped by 50%. And one of the things that we realized as that happened is that the children we were already seeing internally by the staff of the Department of Human Services who do foster care work, they were already seeing kids that would qualify as requiring therapeutic foster care. So it really was the same thing, only partially outsourced and partially insourced. Second reason was because we were providing an incentivized daily rate for every day that a child was in care in the two organizations, Hillside and Catholic Family Center, that had the therapeutic foster care programs. That I also wanted to clarify that we began the insourcing actually at the start of the year, and we anticipated we would finish by June or July. 100% of those cases have been addressed. We treated each one of those cases as an individual case and looked at what was in the best interest of each one of the children. Most of those children have transitioned over to the Department of Human Services. There are a couple of cases where we really felt like it was in the best interest of the child because of the complications of the issues. In that case, to remain with the foster parent that was serving them, and we have actually, we no longer have a therapeutic foster care arrangement with those families, but we have borrowed bed days is essentially what we call it. We're purchasing the time that they continue to stay in that program, and it was solely because as we evaluated each case, that was the best plan for those particular children. It was a very smooth transition for us to make, and it has gone tremendously well.
Great. I'm happy to hear that. Thank you very much for the information.
You're welcome.
And then my last question would be to follow up on at least one letter from May 2nd seeking some information from the county regarding budget lines and for the Indigent Burial Service program, and asking when I can expect responses from that letter.
Madam Chair, I believe the county attorney spoke with the legislator today about a portion of that letter, and the other items on there we will be providing to you. I just need to gather the copies, and we'll have that to you hopefully within a week at the most.
Great. Thank you very much.
Seeing there are no other unfinished business, the August 21st, 2012 meeting of Human Services stands adjourned. The next meeting of the Human Services Committee will be on September 25th at 6 p.m. Thank you and good evening.